Good morning, everybody. It's indeed a privilege to participate in what promises to be a very informative session on a currently hot topic, shaping the future of new age healthcare with digital transformation. Many of us are content to be in the present, not realizing that we have already become the past. During the last 45 years of my professional career, I have learned the very hard way, and I don't want others to make the same mistake, that the future is always ahead of schedule. The only way to be future ready is not just to adopt digital technology, but to actually embrace it. The last 8 months have witnessed an unprecedented radical transformation in how healthcare is being delivered, not just in India, but globally. A strand of RNA has succeeded in acting as CTO, Chief Transformation Officer, for the entire planet, as it were, and made us realize that remote, contactless healthcare, telemedicine, telehealth, e-health, digital health, whatever you call it, will be the new normal even after the pandemic is denotified. Creating awareness and constantly reminding ourselves again and again that digital India is not a cliche, but a reality that make in India must be replaced by make for the world is essential. I am delighted that the Center for Digital Transformation of the CII is embarking on this mission on a war footing. Remember, we need to keep running just to stay where we are. This session has a good mix of senior clinicians, healthcare IT domain experts, and entrepreneurs, all of whom are obviously passionate about deploying ICT, information communication technology, in healthcare. I'm looking forward to learning from these experts. Mastery of the subject presupposes the ability to deliver take-home messages in a very short time. 420 seconds for each speaker is a reasonable time. I have no doubt that all speakers will be conscious of this. We will now start introducing the panelists. It's my privilege to invite the first speaker, Dr. Mufassal. Dr. Mufassal Lagdawala is a very well-known bariatric and gastrointestinal surgeon with over 2 decades of experience. He has helped hundreds of people who have been obese with surgery as a method of treatment. And I understand that he has been given several awards. I could go on and on. He has performed hundreds of surgeries, and I don't want to stand in the way between the audience and him. So over to Dr. Mufassal. The stage is now yours. Kavita, have you handed over to Dr. Mufassal?
Yes, we have. I'm just trying to see on the phone. He's muted himself. Just a moment.
Can you hear me now?
Yes. Yes, sir, we can hear you.
Yes, Dr. Mufassal, please.
Hello, can you hear me?
Yes, doctor, please go on. We can hear you. Continue.
Hello, can you hear me?
Yes, we can hear you. Please continue.
Hello.
Is he on
Yes,
mute?
Dr. Mufassal, we can hear you loud and clear. Continue.
So, hello everybody. Good morning. It's great to be here on this platform. So today I'm going to speak to you. You're getting a view on something which I believe is going to transform technology. So, what I would do is, can I share, please? I'm not being able to share my screen.
Yes, we'll just give you the rights.
Kavita, share.
We've given you the right, sir.
Hello? Yeah, now I can share. Okay,
Yes.
yeah, okay. I think we're good now. All right, so today I'm going to speak to you on digital technologies and which I believe will shape the future of the new age healthcare and its relevance in the recently past COVID pandemic. We all do know that the way COVID pandemic has emerged, we've changed the way we practice medicine, the way we think about medicine, and everything else. All right. So first and foremost, the concept of jumbo facilities and having these massive facilities wherein we could house hundreds and thousands of patients at one go was unheard of in medicine until recently. And what we've done now is we've proven that these concepts work. They work very effectively, and so you can really manage a lot of patients and convert these into state-of-the-art hospitals, if not really state-of-the-art, at least very, very effective hospitals in a very, very short period of time. The first thing we did was when we converted NSCI Dome, which was a sports facility, into a makeshift hospital. How would we manage with a very small team of doctors? How would we actually go out and manage this huge number of patients? So we had a team of around 24 nurses and 7 doctors to manage around 550 odd patients that we had at that point of time. How did we do this? We basically focused on those who needed our help at all points of time and gave kind of self-care to the rest of them. So we used the cameras which were already present in this facility to kind of zoom into every bed. So if we felt that a patient was not doing well, we could zoom into his fingertip to find out what is his saturation levels, whether he was being looked after, not, and move all our resources into that. So it's almost like moving a police force into trying to manage a situation if at all it erupted from the local police station. So this is the first kind of technological advance that we use, wherein we use these kind of cameras. Then we use non-contact cubicles. Again, we do know that the way this pandemic has emerged, usually you saw your nurses or doctors in these white garbs. It is a scary sight to behold when you were a patient. You were intimidated because as it is, you were stigmatized, you kind of felt scared. And the other thing was that the doctor or the nurse himself or herself was sweating away, had his glasses fogged up, was kind of little irritated being in that hot environment. So it probably didn't spend as much time as you would want or he would want or she would want with you. So what I did is I created these non-contact cubicles and kind of had patients speak from phone to phone so that there was privacy maintained and had patients queue up. So this again, where we decrease the gap between the number of task force of doctors and nurses that we had, as well as the patients that we had on post. The other thing that we did with this was we took away the fear of seeing a doctor or a nurse in a garb. We took that away and you saw the doctor with probably just a mask on and became more human, this consultation. This was one technological advance which helped us bridge the numbers, decrease the infection to the healthcare workers. We would have never thought of this until the COVID pandemic came. You wanted to touch and feel a patient, that kind of concept really went away with COVID. Then we thought of how do you convert a sports stadium into an ICU setup and into a dedicated COVID hospital. So we took the shipping containers and they converted them all into ICUs, which were state-of-the-art ICUs. You could manage any patient here. It was fully equipped with the latest equipment. And we were one of the first few to think of eICU setup. Again, living up to my promise of what I told you, wherein I would take the doctor away from managing the patient. We kind of got into this eICU setup. So what we did is we had the patients inside. We had all his parameters, everything coming to us live on a screen, and we decreased the contact between the healthcare worker and the patient. The other thing we did is we had a central task force, which the doctors would sit in a kind of war room kind of concept and monitor all the patients. So at one point in time, we had 50 patients which were being monitored. And any kind of signal of decreasing heart rate or doing anything would kind of zoom into that patient, zoom into his vitals. We could pull up a screen which had all his various parameters come up to us, and we could do this. Along with that, we had a link which could be sent to on a phone via cloud to all the specialists. So you had a cardiologist, a nephrologist, a neurologist, all consulting everything together. So this is a small little video of how we basically did that. These were ICUs and how they were equipped. And this was the war room concept with our doctors monitoring these patients. And that was the online consulting, like I told you, how we did with very this kind of system. We could manage this entire sitting there. Or collect our data, because our data would give rise to going forward. And so majority of the patients in these jumbo facilities, we've kind of got their data because most of the stuff was entered online. We could see them, we could do stuff with them, and we could even request a video call with the patient being there with his family. The other good thing about this data is that now this data can be dissected and diced the way we want it. And we've used that to form our base for machine learning in terms of AI, which I will speak in the next few slides. So I believe that the paradigm shift for the future of healthcare has to be from proactive, from reactive medicine, which we always practice. So when we saw a patient, we would react to his symptoms, we would react to his disease, we would treat it when we came to know. We had to be proactive and we had to go out there and do much more. And I believe that the future of healthcare has to be more predictive. We need to start predicting which patients would get cancer, for example. Diagnostic emerging modalities would need to get better and better. And the moment we can predict something, I think we'll be able to prevent it eventually and treat our patients much better. So I believe the predictive model of healthcare should be our future, at least when we need to treat India and the millions who are there in the villages where there is little option of getting state-of-the-art healthcare. So I believe the basic technology stack in transforming healthcare needs to be, and we've already seen a lot of 3D printing coming in, blockchain technology, and we've used that in terms of how we reach out to our patients, the IoT devices that you saw some of them being used, and AI eventually. So where did we get the idea of 3D printing? Well, this was thought of way back where stereolithography was the concept and how it came out when you exposed to UV light. And he built a machine. This was an engineer who built a UV laser machine to engrave the layers of acrylic into shapes and stack them up. So it was all stacking up of various things. And then eventually a 3D printing was first used for medical purposes like dental implants in the 1990s. Eventually we moved on to now eventually go to more grow organs. And that's the future of 3D printing as we go. So from a miniature kidney to a 3D prosthetic leg in 2008 to a printed jaw in 2012. And now in terms of how we plan. So even in terms of how we plan our surgery, these 3D models can be useful in terms of a liver transplant or to remove tumors in the liver.
Dr. Mufazzal, 1 minute more, please.
Yes. Yeah, I'll go through. So this has changed the way we transform. We can plan our surgeries better. In terms of medical education, it becomes so easy rather than using cadaveric models to use these models for training. Prosthesis, like I told you, we can get almost near natural life prosthesis because of the kind of material that is available today. It's no longer that if you're an amputee, you can't live like a normal life. This is there. The 3D printed hearts, like I told you, we've got. And through drug delivery models, which 3D printing has enhanced. I think The IoT devices I spoke to you, we use this very effectively in the COVID pandemic from using these devices and how they were used. So it became very easy to monitor patients remotely. We use AI with X-ray, at least in this, and the kind of data we've got, we will use a lot for not only natural language processing, but for deep learning from machine learning and various other things, so that artificial intelligence with the data we've got would completely transform. So I'd like to end by saying that that's how I used to be a surgeon. That was me as a Corona pandemic warrior to me now in the surgical model. And I need to thank all these people who made my journey through this COVID pandemic really, really helpful, including my family. Thank you so much for a patient listening.
Thank you, Dr. Mufazzal. I'm sorry we have to adhere to time. It's now my privilege to call Mr. Ramdev, Head of Healthcare Vertical Glow Hill, which belongs to Tata Communications. Krishnan has 23 years of experience in business strategy, IT software, hardware, cloud, etc. And he is particularly involved in public-private sectors where he has headed various digital transformation initiatives. Over to Mr. Ramdev, and again, 420 seconds. Your time starts now.
Thank you, Dr. Ganpati. We like to thank CI and we like to thank Tata Communication for giving this opportunity and all the panelists plus the audience. I have shared my screen. Before that, I would like to take a word that Mr. Ganpati has said. I have missed the train. Just digitalization is a train which is supposed to be right now already enabled and serve industry. But right now I missed the train. Please don't miss it further. Otherwise we would be blocked. The COVID is one of a good example, right? So with that, why we need digital is what we should look forward. One is now the technology healthcare is changing users. What is that? There are a dictation saying that the technology decides now, or the doctor decides now. Now the consumer is deciding, I wanted to be here to do a consult. I want a comfort. I want to be away from a communicable diseases, etc. So that is one which is fundamental, which is changing our healthcare service decision now. Assist. Please ensure that the doctors' scalability so that they can ensure they can do a number of consults in a day and ensure their services are readily available for the consumers or the patients. And a possibility, what are the possibility? One, you have to reduce the cost, timing, and what? A reach. These are the first three pillars. Apart from that, now the digitalization key focus is moving towards consumers. What they want it is basically, I'm at one place, can I consult it to a doctor across the globe? That is one. Can I get wellness information for me? How to prevent? Thanks to Mufi, he has put a lot of effort during COVID to bring up or reduce the mortality rate or reduce the death rate against this COVID. And he has done a very innovative in a quick, and he's not a technology guy. He's a surgical guy, right? So he's a doctor with a quite good experience. But what he did, he wanted to change the problem. He wanted to address the problem. He wanted to solve the problem. So a technology can help and reduce the healthcare related problems. Now coming back, what did Tatacom did? Tatacom in 5 years before, we try to emphasize that, yes, India has a problem. Let's try to focus on how do we reach rural sectors and urban sectors by reducing the travel time, by the consultation time, etc. So Tatacom created a telemedicine platform which not just provided teleconsultation, it also ensured that end-to-end life cycle along with diagnostic and pharma been integrated and given a clinical workflow. We have 450 terabyte of data available right now, both in radiology and in your health information, which is called a radiology solution that we provided to few hospitals, healthcare providers. Now we are working towards our Digi framework. What is a framework? Let's connect with government, NDHM platform, ensure that you can be a platform. The platform can provide a technology for audio video chat, for your record EMR, for EOPD, and for your technologies like radiology, integration between pharma and your diagnostic. As a whole, along with AI and data mining, Tatacom has a platform which can provide a healthcare service provider and a patient to adopt a modern digital platform along with the homegrown solution. So we are not taking away homegrown solution. We are ensuring that what you have, you keep it. We would ensure that we will a solution by which you can scale up, and one you can cure, one you ensure prevent, and also ensure when this pandemic situation is there, India is ready for to face any challenges. Thank you so much, and I would go over to Ganpati sir.
Thank you very much for adhering to time. I think in the allotted time, you have been able to convey exactly what you wanted to convey. Thank you, Ramdev, once again. It's now my pleasure to invite Dr. Chandrakant Kanase, who is a practicing general physician for the last 34 years, successfully treated thousands of patients with diabetes, obesity, hypertension, and so on. And I was particularly delighted to know that he was actively involved in relief work during the Bhuj earthquake, the Kargil war, Kerala floods, etc. We need people like this, and it is very reassuring to see such people here. Over to you, Dr. Chandrakant.
Thank you. Good morning, everybody. At the outset, let me thank the organizers for inviting me and allowing me to speak in this conclave. Let me start at the topic. Say we at Healthy Globe basically working with the providing solutions in the healthcare to the masses, right? So if at all you look at the healthcare scenario in India or globally, basically, for the non-medical person, we can divide into certain groups. One is disease management, another is surgery, third is prevention, where the disease management works for the infections, trauma, emergencies, and every other thing. Surgery works obviously for the swellings and anatomical issues. And prevention, as you know, the vaccines, there are other dimensions also. But what is worrying me is lifestyle disorders, which are basically, since we are worried about the COVID, let me ask the one very specific question to all the audience and to the panelists, which is more severe pandemic? Is it COVID or is it obesity and related lifestyle disorders? Definitely the answer would be more invasive is a lifestyle disorder pandemic. So we all need to pay attention to all this. Basically lifestyle disorders or the lifestyle in health and disorder, basically it is either a lifestyle is either a causative or contributory factor. I do agree it has got a multifactorial approach. We need to have a multifactorial causation and approach. But these are the certain diseases, as I said, the PCOS, fertility issues, the depressed mind and other thing. And then obviously the joint issues and acidity and constipation. We really don't need to use drugs for most of these things, or if at all, drugs should come at the second line, not at the top priority. All those who suffer from this disease should go with the changes in the lifestyle disorder first. That's what I've been practicing for last 8 years. And let me tell you all this audience that I have been using, if not the digital platform, but telemedicine, I have been using it for last 8 years with good success ratio basically, and patients find it very convenient also. As they said, the problems with the lifestyle disorder, and that is related to food, activity, exercise, sleep, sunlight, and all other things. Basically, all these lifestyle disorders, the obesity, diabetes, hypertension, ischemic heart disease, they are considered as irreversible and progressive. That's what has been taught in the medical school even today. That's what I learned from my medical when I passed my MD and other thing. And basically, the lifestyle, the importance of lifestyle is ignorant, or it is considered as non-important basically. And drugs are given the first priority, and the lifestyle is basically handed over to the patient. Basically, the lifestyle, the importance of lifestyle, the correct lifestyle is not understood very well. That is one more problem with the lifestyle. And that patients are supposed to take care of themselves. That is the worst part of the story. We as a physician don't think that we need to address or counsel our patients on the issues related to lifestyle. And there is one more unwanted teacher that is much more in the society, that is social media. Obviously, it adds to the confusion rather than the knowledge. So there are multiple problems basically about this today's health scenario. It's a travel time and cost, that you all agree. And there is a consultation cost, there is a problem with maintaining the medical record, and obviously the infrastructure cost that the doctor has to face. that is very high. So all these issues can be addressed with the advanced digital technology in the form of telemedicine. I will use the telemedicine word for all the remotely operated medical services. Basically, we at Healthy Globe, we are based in Pune. Basically, we are committed to provide expert quality healthcare services at a minimal cost. What you can say is in a conventional term as a throwaway cost, right? And the cost includes the money, time, and convenience, right? With the help of advanced digital technology, we have been tied up with the many leaders in the field, and we are preparing ourselves to deliver the best to the society. Basically, digitalization is the solution to reach public at large. We can basically earlier, without technology, we used to attend around 50, 70 patients a day. Now with the technology, we can attend around 300, 400, maybe 500 patients a day, right? With the same number of people working, right? So it's very easy to reach the public, and they can also interact with the doctor or a consultant from their home, basically. So through this new mode of technology, a digitalized solution enabled by Healthy Globe to solve all the problems. That's what I mentioned. We have got 5 models basically on which we are working. We are delivering services. That is telemedicine services using the advanced digital technology. Basically, the patient calls up and there is the ERP system established, and through which we provide a solution to the medical solution to the patient. Obviously, there are certain medical conditions where telemedicine may not be advisable, may not be required, and may not be useful also, right? So the most important is the daily care of the daily problem, general care of the daily problem, like the cough and cold, abdominal pain, backache, headache, and all those things. That is also possible on this thing. The most important component of the problem, the solution, is the lifestyle disorders, right? We have a product called as a corporate champion, where we are tied up with certain corporates, and the employees are added to the list, and we give them service related to diabetes, obesity, hypertension, PCOS, depression, anxiety, stress related, sex related, sleep related, all those issues. And then we are planning basically in last phase of a virtual clinic, that we have got a cab in which all the system is installed, and we go to the periphery or to the door patient, right, with all those things. Or even patient can call to the clinic and get himself examined with all those gadgets, right? And there is another one thing is doctor to home. That's what we are delivering. That a patient calls the system and invites a doctor to attend to his problem at home. So these are all the 5 services that we have been catering to, right? And basically, there are certain people who are, it's a conglomerate basically. It's a Healthy Globe Private Limited is basically organizer, is an entrepreneur and a coordinator. Then me, along with my team under the banner of Doctor to Home and Clinic Private Limited, we take care of the medical problems or the medical issues or the medical service provided. It's a team of consultants, doctors, nurses, nutritionists, physiotherapists, counselors, and psychologists, all about 100 people working under a banner. And there are another crowd with a group of panel hospitals, pharmacies, diagnostic and imaging centers. And obviously, the platform is provided by, we are using the platform provided by the Tata Communication. There are software networking and business solution providers, right? This is about what I would like to tell you. This is our location map. Thank you, the other panelists and the Dr. Ganpati. Thank you.
Dr. Ganpati, please unmute yourself.
Sorry, this is an example of how a fool with a tool is still a fool. With all the technology at my disposal, I forgot to unmute myself. So this is a classic example of how it is individual that counts and not the technology. Sorry for that. I would now like to call upon the country head of Dell Technologies, Kamal Arora, to share with us his incredible experience of over 3 decades, extensive professional experience from solution business, sales, channel management, business development, etc. We are all familiar. We all know that Dell Technologies is one of the leading multinational companies. I had the privilege of meeting Mr. Dell about 15 years ago in the United States. And I remember going around their head office also. And I particularly want to congratulate CII for getting the right mixture, a clinician, a homegrown company, an international company representative, and so on. Over to Mr. Kamal.
Yeah, thank you very much, Mr. Ganpati, and for nice words. Good afternoon, everyone, and thank you, CII, for having me on the panel. I'm not sure if I'm audible.
Yeah, you are loud and clear.
Okay, all right. So, the share button, Kavita, is still not activated, so I don't know. It's still hanging, but I will start. So thank you, Mr. Ganpati, once again. So, we have just heard the experts talking about what technology can bring on table, and the one of the established factors that we have very less specialists to kind of address humanity and treat them, professionals as doctors and nurses, and we really need how do we get the technologies support this expansion, and this technology has bring in absolutely the ask of multiplying factor of getting closer the patients as well as the doctors and the professionals. So with that, what has happened is that I'll take an example of current scenario wherein the pandemic has actually what it has does for a live example, So the technology is bringing couple of things around, like edge screening. Dr. Lakarwala talked about the X-ray, which are providing the artificial intelligence comparison between the right, the lung scenario as well as of the patient, and it can detect COVID very fast or other diseases very fast. Similarly, there are ample of edge screening solution which can detect with fever or other symptoms, and these are artificial intelligence which are built in for quickly diagnosing. Then all these guys can be tracked, and the enforcement can be done through, again, a technology enabler wherein you can map to Arogya Setu map kind of applications, or Bluetooth and GPS enablement. All that tracking.
Mr. Arora, if you have any slides, you can show them. I understand it's activated.
Okay, I'm trying. I don't know why it is not coming. So some technology glitch, as you said, sir, rightly. I'm not sure if it is coming now. I have enabled again for this glitch. Well, still go through, and
okay, please proceed. Please proceed.
So then all these tracking enablement can actually help the law enforcement agencies or healthcare agencies for creating situational awareness centers, which can actually give what are the hotspot areas, what are the green areas, so that the adequate efforts can be made so that this does not spread beyond the containment zones. And then the predictive modeling can help plan the testing better, the treatment better, availability of healthcare professionals, as well as availability of drugs and so on and so forth. All these operation centers, pandemic operation centers, are basically activated at various city level monitoring centers. Finally, on the leveraging emerging technology, Dr. Mufazzal talked about 3D printing. That's one of the greatest asset, I would say. The clinical costs can be made, the implants can be made and can be tested. Artificial intelligence bring in a lot of benefit in drug discovery, for example. It can use the computation pathology and advise what drugs will suit one better. And accordingly, the supervision of drugs can be done, and clinical decision can be supported. There are a lot of IoTs which can be wearable, which can provide the remote healthcare to our villages, to to rural area where the doctors can't reach, that much of the specialists can't reach. The healthcare workers, ASHA workers, etc., are wearing these kind of health management systems and providing that data back to the specialists so that they can advise what kind of care is required in such situations. And the augmented reality, virtual reality are providing doctors a very good visibility to the patient, so that the diagnostics can be much better, faster. Even they can there is a consultation which can be done on surgery, etc. All these kinds, and other like medicine from sky drones, gene therapy, research, blockchain for telemedicine, robotic surgery. All these are like technological help which comes along when we work along with the specialists and along with the service providers. I think one need to really know that the data is the key here. When data is to be dealt, like for example genomic data, the genomic data per genome is about 800 MB. And if we're talking about cancer genomes, it takes about 300 TB plus, here and there. So every such kind of issue generates a lot of data which need to be dealt with. For example, our CT scan images, each image can be 1 GB of data. Now, how do you multiply it with when you multiply it with multiple patients across country? It's a huge data. With the national new digital health mission announcing the health policy and the health mechanism, I think this is going to be very, very critical, that how we are dealing with all this data and processing in a manner both patient and is getting advantages and taking the advantage of this, as well as doctors and professionals are able to be more effective, efficient in dealing with more and more patients, so that our humanity can get the advantage of this transformation. In summary, there are 4 pillars around the healthcare transformation as we talk about. It's the health IT, which is where the data is stored, and TCL does a lot of stuff like that, wherein we partner with TCL and others when we are creating all the data for non-communicable diseases, patients with that, and that data helps governments to address the public at large. The connected healthcare transformation, as we talked about, the IoT, AR, VR, clinical workforce productivity, all of that is the second pillar. The third pillar is pharma, the precision medicine transformation. How do one know how the genomics works, how the drugs will work, how is the bioinformatics are working on this, and analytics can compress the timeline of research from years to days, which can help. And that's exactly what is working in even developing COVID kind of vaccination, where you can simulate things. And finally, on the application transformation, as we heard, there are so many applications which can come up to resolve some of these issues, and these are running on these IT platforms, which can actually help in managing entire cycle. So we work very closely with all of them, and we continue to look forward to provide this to the industry, to humanity. And so I was personally very touched with your comment that you have met Michael himself. So the kind of passion he carries in providing this technology, creating this technology for humanity progress. So thank you so much, and back to you, sir.
So please unmute yourself.
I think I'm getting early Alzheimer's disease. Okay. Just to introduce Mr. Sarvana Kumar Shaktivel, Director, Technical Soft Team Solutions. As a CTO, Chief Technology Officer, he has the overall responsibility for organizing technical decision-making, client interactions, etc. He is the sort of individual whom clinicians like us are very badly in need of. Over to Mr. Shaktivel.
Thank you, sir. Good morning, everyone, and thank you very much for CII to give me this opportunity to present our capabilities. And We are Soft Team Solutions, and we are basically a software engineering and technological company enabling solutions to various medical equipments and information systems across the world. So we are in this industry for more than 23 years, and we are primarily focused only onto the medical systems, healthcare technology solutions to global companies and hospitals.
Shaktivel, could you just put it on full screen, please? Your PPT.
Sure, sir. I have done it. Yeah.
Yeah.
So we develop solutions for medical OEMs, that is basically medical equipment manufacturers, and we develop various kind of application and embedded software solutions to those medical equipment companies. And also we develop solutions as information technology to companies and across India as well as world. So this is an engineering company, so we are serious about the process. So we rigorously follow the regulatory compliances and process to meet FDA 510K and CE marking, etc. So our strength is primarily the technical, richer domain knowledge, especially medical, and higher technological skills and knowledge. So with that, we are providing solutions in 4 areas. One is the healthcare imaging product solutions. So we have products that that are more than 15 years old that enables filmless, paperless solutions to hospitals long back itself. And we provide software solutions and services to medical device companies where we enable the interoperability, not only the solution inside the software, but also makes the modalities or medical devices interoperable to other systems. So the interoperability is the key in terms of integrating the connected systems. And now we are talking integrated solution. These were possible because we have been doing this integration work for past 20 years to various medical companies, including the bigger companies like Philips and GE, etc. So when I say digital interoperability, which includes the standard way of interoperability like DICOM, HL7, IHE, etc. So we also work with the technological research institutes in improving the clinical diagnostics through various automatic means. The automation includes the automatic detection and the classification of anomalies, including tumors and various levels of tumors, stages, and then assist the doctors in terms of diagnosing such studies. Apart from that, we have also built the solution as a framework of solutions that is like a software components, like a hardware component, the components that is enabling various healthcare providers and the companies to integrate and prepare a solution faster to the market. So that's the product solutions. And apart from that, we also provide healthcare IT consulting and support services to large and small hospitals in terms of digital transformation, where we provide a strategy, planning, implementing, and automating the hospital, primarily in terms of integrations. So our journey is pretty long, and we've been since 1997. We've been in this field and providing solutions to global companies. So we started our solution providing to companies in US, Austria, German, various places, and we have done software solutions for ultrasound. We are the first one to provide 3D, 4D ultrasound solutions to Kretz Technik in Austria, which is now a GE company. And this platform, I would proudly say, this is a framework which is almost like 20 years, and still this framework is valid. If you take any hardware, it has a life. If you take our software frameworks, they are made such that it is scaled to this level. It is now, even this product is still in the market, and it is working with the software solution that we have developed over 20 years time. And Nucleatron is another company which is in the radiotherapy field. So we are providing radiotherapy solutions, components to companies which makes the simulation, treatment, and planning systems. Likewise, we have worked with various companies in India. Our partner was L&T. Even though L&T has an information system division, we worked with us because of our domain knowledge and technology. So we worked in developing ultrasound, patient monitor, central monitoring, Even 10 years back itself, we have created solution that can stream the vital parameter data to any location in the world through a central server. So which can not only monitor one ICU, but also many ICUs concurrently in local as well as remote locations, but also to the mobile devices. So that's the kind of solution that we have enabled for Indian companies especially, and we are still having a relation with Scanray, which is now the L&T company. And we have, in recent years, we have enabled an eye care cloud solution for Robert Bosch, Bangalore. And this was inaugurated by our PM, which is basically a fundus camera taking the images and streaming to the cloud. The cloud will do the analysis of the images to detect various eye anomalies and then report them to doctor. This is a product solution that is powered by our software solution. And we also recently worked with a virtual hospital, which is before to pandemic. And this solution is one of the state-of-the-art solution, which has a roof-mounted camera, which can monitor the ICU patients very closely, which is a PTZ camera, which can go and zoom the patient vitals as well as monitors, drips. And not only monitoring, but also we learn from the image and detect various aspects of the or various parameters of the ICU patient. So, and provide these vitals to the doctor so that he can make informed decisions. So these are all kind of solutions that we offer to various companies across the world. So in terms of products, over the time we have developed our products and provided the solutions to, again, various hospitals and companies. So initially as a company, when we started, our challenge was to digitize the images. So the medical modalities are non-interfaceable. So they produce video, they produce audio, or they produce still images. So our task was to digitize the image. So our initial solutions were converting the video or still images or films to digitizing it. So our initial solutions were scanning solutions, which converted the product, and later on we made interoperable. Next stage is sharing the data that we gathered. So we created toolkits like HL7 DICOM toolkits to companies and OEMs. Then we made our own workstations. So we created a diagnostic workstation products like we call it our Stellar Works, which provides radiologists with the images presented in a large scale monitors where they can do a diagnostics. So which again presenting the image to doctors and let them do a digitization of voice and then translate those information into produce reports, and the reports get stored. So, and then we moved from radiology workstations to PACS products, which again automating the hospitals in terms of filmless, paperless process. So as soon as the patient enters and we get into the RIS radiology information system, which tracks the patient, and then we convert the work orders directly into the modality. So no need to enter the information at the modality, and they enter the patient information automatically comes to the modality. And then we pick up the image and deliver to the doctor, not only to the local network, but also to the web view and remote location. So the doctor at home can still look at the expert at home can look at the image and provide the diagnostic reports. So that is the level. And we also worked with the government and the DBT, Department of Biotechnology, in terms of
2 more minutes, please.
Yeah, thank you, sir. So advanced tumor detection and other areas. So likewise, we are scaling our product. And recent years, we are developing solutions which are more AI oriented, and also using the learning techniques, the machine learning techniques to analyze the data. Now we have an enormous amount of data in which we convert this, we analyze these images automatically and find the anomalies from the image, like detecting the tumors and the levels of tumor, grading the tumors, and early detections, prognosis. All those things we are now taking the big data and making the data available for ready for analysis, and providing assistance to the doctor, and making them available for large scale decision making. So with that, I would like to thank the panel as well as Dr. Ganapathy and the CIA for giving me opportunity to present our companies. And I'm sure we with our technology will be able to enable large scale solutions to various companies in India and abroad. Thank you so much.
Thank you. I think on behalf of the virtual audience, on behalf of CDT, CII, and on my own behalf, I wish to express my sincere thanks to all the speakers for sharing pearls of wisdom from their immense personal experience. I just realized that the five of you together have 130 years of experience, and to ask you to summarize it in 40 minutes is obviously very unreasonable. The most important message which I learned in the last 40 minutes is you cannot learn swimming from a postal course. You have to get into the water and dirty your sleeves. This is what all the panelists have done. I'm particularly impressed by Dr. Mufazzal, a surgeon by training, who demonstrated to us very nicely the use of technology. I couldn't imagine in my younger days of managing 500 people. Yes, we did have huge people in Government General Hospital, Madras Medical College, where I worked in the 70s and 80s, but then we had no technology at that time. And using containers to make portable mobile ICUs is really innovation at its best. 50 patients being monitored by specialists with smartphones are high. And then he also spoke about 3D printing, IoT, artificial intelligence, and so on. Mr. Ramdev of Tata Communications emphasized for a technologist, I thought this was very nice. He spoke on patient education. He spoke on promoting wellness, which I think is the future. Keeping people healthy is much more important. It's actually a sad day when a patient comes to a hospital. And I think that in the lifetime of my grandchildren or great-grandchildren, the entire concept of hospitals as a place where you diagnose and treat is going to be radically changed. He spoke on how distance today is meaningless. I was remembered of an old phrase which I used long ago. Geography has become history today. He spoke on digital platforms, the necessity for integrating, whether it be with chat, EMR functions, and so on. Dr. Chandrakant very rightly pointed out that NCD, non-communicable diseases, diabesity, as we use the word, is a bigger pandemic than the COVID-19. The COVID-19 has drawn everybody's attention. I don't have exact numbers, but I'm sure that the NCD's mortality and morbidity is hundreds of times higher than the COVID pandemic. Thank you, sir, for pointing out this. This is very, very important. Again, Dell Technologies country head, Mr. Kamal, he again spoke on augmented reality, virtual reality, and I think AVR, augmented virtual reality, mixed reality. These are no more questions which will be asked in an examination, but this is what is happening. I've had the opportunity to actually use this. I mean, use this not in clinical practice, but to see many of these being demonstrated. And believe me, it is unbelievable to see an augmented virtual reality, 3D anatomy and physiology and surgical anatomy of the human brain. And I honestly think we could see it much better than what we used to see in the operation theater itself. He also emphasized the necessity for large data, with the National Digital Health Mission becoming a reality in a couple of years. Hopefully, images are going to be transferred, 1 GB images for one particular person. We need to radically look at providing bandwidth, not just in the metros and the state capitals, but at least in suburban India, in Tier 1, Tier 2, Tier 3 cities, if not the villages. Sarvana Kumar spoke on OEM. He spoke on software, the necessity for adhering to regulatory compliances. He spoke about interoperability and how some of the software used 23 years ago are still being used. They are upgradable, in other words, to 3D, 4D ultrasound. When he mentioned this, I was just reminded of what I read recently. I'm sure some of you are aware of it, that FDA have formed a new division in 2019 entirely dedicated to what they call SAAMD, that is software as a medical device. So in the future, it's already started, not in the future, from 2019, any software which is the basis of AI in healthcare, whether it be robotic surgery, whether it be diagnosis, whether it be in artificial diagnosis of diabetic retinopathy, predictive analytics used in cardiovascular diseases, and so on. This has to be approved by no less an organization, by the FDA. It is going to be called software as a service for medical devices. And again, this is going to bring forth, I'm sure in the next couple of years, we're going to see the first case being filed against an AI. Who is going to take the responsibility? Is it the program developer, the software engineer, the engineer who actually made the AI device, and so on and so forth? So these are problems which need to be answered in the future. Now, I belong to the BC era. When I say BC, I don't mean before COVID, I mean before computers. I was the last group of neurosurgeons in India who were trained before even the CT scan came to India. If you thought that BC refers to before Christ, you are not wrong at all. That is the difference computers have made in the last 6 decades. I could go on talking and talking, but I have only one take-home message. Obviously, I'm a technology buff, otherwise I would not be here. However, I'm concerned that with AI and information communication technology making headroads and becoming center stage, on the way to becoming center stage in healthcare, the doctors of tomorrow may forget to deliver tender loving care, TLC. The statement, an apple a day keeps a doctor away, is being replaced by an app per day keeps a doctor far, far, far away. We should not forget that technology is a means to achieve an end and not an end by itself. When you have a hammer, everything around you looks like a nail, even more so if it is an expensive hammer. Maybe in the lifetime of my great-great-grandchildren, even a chatbot or a humanoid will be able to empathize, sympathize, and commiserate with a sick individual, even wiping a tear virtually. Till this time, let us continue to be humane. We are in a stage of transition. All transitions offer great opportunities. We need to ensure that in our anxiety to achieve radical digital transformation in healthcare, we do not forget that we should not be treating a laboratory report or a shadow in an MRI picked up by an AI system. We should not even be treating a diseased organ, for that matter, not even the individual with a health condition in isolation. I was taught to treat the family where one of the members is sick, take into account what the patient wants, what the family wants. AI should not, digitization of healthcare should not lead to depersonalization and dehumanization of healthcare. On the contrary, with digitization, the clinician should now, in fact, have more quality time to spend with the patient and just listen to the person whom this technology is going to be used. So once again, I would like to thank CII, and I understand that the next session on social inclusion and upliftment using digital technology will commence in a few minutes. Before I request the organizers to take over, may I use this forum as a method to please request all of you, the very fact all of you are here, the panelists, the virtual audience, shows that you are interested in digital healthcare. Please do become members of the Telemedicine Society of India. We have our annual conference on December 18, 19, 10, 20th, and we will be delighted for the industry, for entrepreneurs, for medical experts, for legal experts, all of you to participate in this. We need to have a collective body, whether you like it or not. Digital healthcare is the future, and I think we need to have a collective voice where we can represent to the regulatory authorities and to the government to ensure that every one of us benefit from the digitization of healthcare. Thank you, Kavita, once again for inviting me to participate in this session. As you can see, I am a stickler for punctuality. If there are any questions to be answered by the panelists, I think we still have a couple of minutes more.
Thank you, Dr. Ganpati. In fact, I would like to thank all the panelists. In case there is any one question that any of you would like to ask Dr. Ganpati, please go ahead. It's been an
Or any
honor
of the other panelists.
Yeah, or any
The
other
question
panel.
can also be addressed to the panelists individually.
Yes. If there are none, then I would like to thank you. And I think we already have the panelists of the next session ready. Thank you, Dr. Ganpati. It was an honor for us to have you chair the session. Thank you so much.
Thank you, everybody. Bye.
Thank you, sir. Thank you so much.
Thank you. Thank you so much.
Thank you. Thank you.